When it comes to marijuana as a gym goer, should you puff puff pass or puff puff and keep on puffing because it's going to help me set a new personal best? That's the question so many are thinking about. Does smoking weed help improve performance? With the acceptance of marijuana growing every day, both legally and socially, it's only inevitable that someone will wonder if it can. At the same time, we also know a bunch of people are doing it anyway, perhaps falsely believing it's not going to hurt them. Or maybe they're right. Maybe marijuana is going to help. It's been shown to be an effective aid for other issues, so why not your bicep growth? We're going to find out. A lot has changed in the past decade with marijuana and society's stance on it. With rapid legalization around the world, including inside the US, laws are changing at a blistering pace. Therefore, while these stats may not be correct for long, currently marijuana is legal in 38 states for medicinal use and is legal for recreational use in 24 states. This means that anyone of age can go buy some bread, milk, and a bag of weed anytime they want in almost half the states in the USA. This legalization is largely in part to the fact that we know a lot more about the plant than we once did. It's now accepted that marijuana has numerous legitimate health benefits for those who partake. This is evident as it first became accepted in the medical field largely to reduce pain. However, it's also been found to reduce eye pressure, which has made it a common treatment for those with glaucoma. Other possible medical uses include reducing nausea in chemo patients, improving loss of appetite, relaxing those with epilepsy or spastic muscles, and it can treat various neurological and mental disorders such as PTSD and Parkinson's. As of late, the sale of CBD for therapeutic purposes has grown extensively. With this increase in use, it was only a matter of time before someone decided to see what happened if they hit the bong before hitting the gym. Before we go further, let's define some terminology for different substances to help you keep things straight. The first is marijuana. Marijuana is the common term for the actual cannabis plant, a plant with psychoactive properties when ingested, usually through inhalation. These plants have hundreds of different compounds, known as cannabinoids, which are responsible for getting you high. Related to marijuana is hemp. Hemp is basically marijuana that has THC levels less than 0.3%. It's basically marijuana that doesn't get you high, but this also brings us to the next term, THC. THC stands for tetrahydrocannabinol, and it's one of the 100 different compounds known as cannabinoids which are found in marijuana. It's the main psychoactive compound in marijuana that makes you high. This high occurs when it interacts with the cannabinoid receptors in the brain and the central nervous system. Another word you'll hear a lot is CBD. CBD stands for cannabidiol. It's another cannabinoid found in marijuana. Unlike THC, it does not have psychoactive elements, so it doesn't get you high. It's commonly sold in its isolated form for people who want the calming effect without the high. Even though it's just now marijuana's been regaining legality, interest in it for possible performance enhancement occurred quite a long time ago. In fact, it'll probably be a surprise to you to find out just how long researchers have actually been studying the effects of marijuana and performance. One of the oldest studies on the green stuff comes all the way back from 1975. Unfortunately, it didn't necessarily help to start building the foundation for pro-marijuana use in the world of sports. In it, the researchers tested the effects of smoking on both hand grip strength and a submaximal bicycle ergometer test to measure work capacity. While there was no effect on grip strength, there was a drop in work capacity. This will become a common trend. Some things aren't affected and some are. Regardless, the only positive from this study is that it didn't cause a drop in grip strength. That's probably not going to make a big hit as a sports supplement. This makes sense though. It seems pretty obvious that inhaling smoke can't be good for performing exercise for extended periods. Since that time, researchers have identified more than one mechanism for an adverse effect. This can affect your cardiorespiratory, pulmonary, or even skeletal muscle systems. Upon smoking, there's an immediate decrease in airway conductance after inhalation. This will increase airway resistance, making it harder to breathe. This generally peaks 15 minutes after use and may persist up to 60 minutes after inhalation. What's interesting is that marijuana will increase resistance even if it's not inhaled. When consumed orally, a decrease in conductance will take longer to peak at 3 hours, but it may last up to 6 hours. At the same time, marijuana can increase heart rate by 30 to 50% after smoking. Not only does this increased heart rate prevent high-intensity training, it's also one of the mechanisms behind reports of feeling anxious or panic. Apart from the physiological effects, increased anxiety and panic on their own can cause a decline in performance. In terms of your skeletal muscles, THC again has a negative effect, as it may decrease mitochondrial activity by 12 to 15%. While these numbers do come from studies on mice, it has seen some major implications for us. You see, your mitochondria is where the adenosine triphosphate is produced. Adenosine triphosphate, also known as ATP, is your body's energy currency, and it's required to power every muscle contraction. When energy is needed, a phosphate group breaks off of ATP, which then releases energy to trigger muscle activity. This means that the amount of work you perform is dependent on the amount of ATP you have. If marijuana decreases your body's ability to produce ATP by 12 to 15%, this will shorten your ability to work by 12 to 15%. Another concern that athletes should have with smoking marijuana are the possible negative effects on the endocrine system, the system that controls your hormones. Testosterone is the male's primary sex hormone and strongest anabolic hormone. It also has a confusing relationship with marijuana smoking, as studies show contradicting outcomes. This includes having a negative impact, no impact, or even a few with positive impacts. For example, one surprising study showed that 21 days of intense use had no impact on the smoker's testosterone levels. The same researchers then conducted a similar study but measured luteinizing hormone levels. Your luteinizing hormone is responsible for signaling Leydig cells in your testes, which triggers the production of testosterone. Again, the intense use of marijuana showed no negative effect. Now let's look at the counterpart of testosterone, cortisol. Cortisol is your stress hormone and it's catabolic in nature. Contrary to testosterone, its presence promotes the breakdown of muscle fibers, not good for athletes. Another difference compared to testosterone, it seems as though marijuana causes an increase in cortisol when used at the levels of normal use. It doesn't need intense smoking for these negative results to occur. In fact, there even seems to be a dose response. Dose response simply means that the more marijuana you use, the greater the rise in cortisol levels. This generally suggests there is a direct mechanism which creates the relationship. Regardless, so far you have higher cortisol levels and possibly lower testosterone levels. In terms of growth hormone, marijuana use tends to also have a negative effect. This is likely due to marijuana stimulating somatostatin release, which inhibits the secretion of growth hormone. However, this tends to be an acute response rather than a permanent change from chronic use. All that's to say that, in general, smoking marijuana tends to have a negative effect on the endocrine system, especially when it comes to optimizing muscle growth. It likely lowers your anabolic hormones and increases your catabolic hormones. We should also note that this observation comes from relatively few studies. Therefore, we can't make any conclusive statements. In addition, while these numbers do show the endocrine system is affected, we don't know if it'll have any noticeable effects on training. Will you lose your gains if you smoke just one time? Or can you smoke as much as you want as long as it's after your workout? We don't know, but as of now, we know that marijuana will more than likely have no effect or a negative effect on your hormones. Now that we have a better understanding of some of the physiological responses to marijuana, let's go ahead and look at some actual performance studies to see what happens in the real world. Let's start with another study from way back, 1974 to be exact. This study looked at the effect marijuana had on participants with exertional angina. Exertional angina is a type of coronary artery disease which causes chest pain when the person is exerting themselves due to the heart not receiving enough blood. The study used 10 patients to compare the effects that a marijuana cigarette or a placebo had on their exercise time until reaching angina and needing to quit. While the placebo decreased exercise time until angina by 8.6%, the marijuana cigarette decreased exercise time by 48%. This means that the patients could only exercise for half of the time before they needed to quit due to angina. Remember when we mentioned the first study from 1975 that saw a decrease during submaximal cycling? Well, we found two more. These studies showed a decrease in performance when completing a Wingate test. The Wingate test uses a short burst of high-intensity cycling for 30 seconds on a cycle ergometer. It measures and compares the individual's ability to achieve and maintain anaerobic power. This measures anaerobic capacity, anaerobic fatigue, and peak anaerobic power. What's surprising is that in one of the studies, the experiment simply used marijuana users versus non-users. This means that they merely confessed to the frequent use of marijuana, anywhere from daily to 4 times a month. To be clear, they did not necessarily partake in smoking before the test. In fact, 3 of the 10 users didn't even test positive for having metabolites, such as THC, in their system. This suggests that the chronic smoking of marijuana can have a negative impact on your anaerobic performance even if you haven't smoked recently. This is an important consideration, as an athlete cannot simply say they will only smoke after training or playing, as some negative effects aren't time-dependent. However, while their anaerobic performance dropped, there was no negative effect on aerobic performance, pulmonary function, or muscular strength. Why could this be? One theory behind this, at least for the no effect on aerobic and pulmonary function, is that inhaling marijuana may affect the body differently compared to administering using another method. For example, edibles consist of eating marijuana rather than inhalation. Dabbing is a way to take marijuana by inhaling the vapor of an oil and is believed to be less damaging than breathing in the smoke. Compared to other studies that only used inhalation, this study did in fact have participants that used these alternative forms of administering. This seems to support the theory that there is in fact a difference in the body's response to marijuana dependent by method of use. But again, there needs to be more studies to make a conclusive statement. However, even though this study didn't find a negative effect on pulmonary functions, it doesn't mean other studies don't find one. One of the first studies from the 1970s recorded the negative effect that smoking marijuana had on the cardiorespiratory and pulmonary system. So did this more recent study in 2007. Well, kind of. Researchers found that smoking one joint has about the same effect as smoking 5 cigarettes. This isn't totally surprising, as smoking one joint is estimated to result in 3 to 5 times higher levels of carbon monoxide and tar deposition compared to a cigarette. This may come as a surprise to many, as marijuana is generally considered to be not as bad for you as smoking is. In reality, both contain many of the same harmful components. So much so that many respiratory symptoms of smoking cigarettes also appear in those who are chronic users of marijuana. Similar symptoms include airway mucosal injury and inflammation, cough, phlegm production, and wheezing. However, even with all these similarities, something strange happens in terms of pulmonary function in another meta-analysis. In terms of pulmonary function, this study found no evidence that increasing exposure to marijuana adversely affects pulmonary function. Again, pulmonary function refers to your lungs' ability to exchange oxygen and carbon dioxide during respiration. In fact, low-level users of marijuana actually had greater pulmonary function. This association lasted up to those who smoked one joint every day for 7 years. Now, going above this did result in a reversal, meaning that a negative effect was found. However, one joint a day for 7 years is a lot, and it's very surprising that users had higher function. One of these theories suggests that the methods often used to smoke marijuana stretch the lung and increase total lung capacity. For example, smokers will usually take deep, big drags and fill up their lungs with smoke and then hold. And this study is not a fluke. In fact, other studies have looked at marijuana use and pulmonary function and have found no negative effect. Another study on performance with confusing results from smoking marijuana was done in 1986. In it, participants performed 2 tests of progressively more challenging exercises until leg failure. Initially, heart rate was increased by 26% after smoking marijuana, which also led to an increase in VO2 max. However, this difference only lasted until 80%. At maximal heart rate, the heart rate equaled during both conditions. In fact, RVE, VO2, and VCO2, the volume of exhaled carbon dioxide, were the same at maximal exertion in both conditions. However, there was a decrease in that maximal work capacity again. What about post-workout recovery? Could smoking a joint with a shake post-workout have some benefits? Well, a pilot study examined this by having participants use CBD and perform back squats. The researchers then documented muscle damage markers, such as levels of creatine kinase. The results are interesting. On a positive note, CBD use did result in lower levels of markers suggesting a less amount of muscle damage 24 hours post-workout. That sounds great, but the effect on actual performance is not so great. CBD use resulted in a greater decrease in back squat performance. Ironically, the decrease in performance and increase in recovery are believed to be due to the same mechanism, the skeletal muscle relaxation effects of CBD. But that's just one study. Other studies also show benefits of taking marijuana after training. For example, a study from 2020 found that CBD oil can be used to reduce muscle pain from DOMS, delayed onset muscle soreness. DOMS is when your muscles begin to hurt 12 to 24 hours post-workout. When compared to placebo, CBD had less discomfort post-workout and then 24, 48, and 72 hours post-workout. At 96 hours post-workout, the CBD group had discomfort scores closer to pre-workout levels than placebo. This reduction in discomfort can prove valuable in improving an athlete's ability to perform repeated bouts of performance. Yet another study found that marijuana not only reduces discomfort of DOMS, but it also decreases several other markers of inflammation. One of the mechanisms for this is the interaction of marijuana with cannabinoid receptors in the hippocampus. These receptors are involved in regulating nociceptive perception and can therefore decrease pain. Further, marijuana also interacts with your cannabinoid receptor 2 found in the endocannabinoid system. This activates immunosuppression through several different mechanisms which play a role in decreasing inflammation. So perhaps smoking weed is best used post-workout with your protein shake, while hitting the bong before a deadlift probably won't lead to any new PRs. Hitting it after could result in less soreness. A more interesting use for athletes is the treatment of TBI, or traumatic brain injury. TBI is one of the fastest growing health concerns for athletes today, specifically for those who participate in contact sports. To date, most of the proposed benefits to sufferers of TBI are theoretical due to a lack of studies. For example, it's believed that the anti-inflammation properties of CBD could act as a powerful neuroprotectant. At that same time, some research has shown that CBD use may significantly reduce psychological behaviors caused by TBI. These are things such as anxiousness, aggressiveness, and depressive behaviors, but again, more studies are needed. Another area of interest is with sleep. Sleep is crucial for athletes and lifters, as they accrue more fatigue and damage than the general public. Unfortunately, most research is limited to subjective measures, meaning we only have testimony from users. Yet again, more studies are needed. The worst time to take marijuana is before your workout. The smoke can affect your respiratory systems, but it also artificially increases your heart rate. As a result, your workout capacity is limited and you'll likely fatigue sooner. While we can say there does seem to be some benefits post-workout, specifically treating DOMs, we need to remember that some of the negative effects of smoking happen to those who smoked only 4 times a month. This means that as far as timing goes, there doesn't seem to be a way to completely mitigate your risk of negative effects. However, there's probably less of an effect on performance if you smoke after training. Another variable to consider: eat your pot brownies. Again, some of the negative effects were seen merely from having THC from marijuana in your system, regardless of the method to consume. However, some of the respiratory effects did not present themselves when consumed in other manners such as eating. This makes sense, as drawing smoke into your lungs is drastically different than a pot brownie being digested by your stomach. Therefore, with what we now know, it appears that the best scenario would be mitigate negative side effects of marijuana by eating it after your workout. Also, less is better. We want to be very clear, this is merely an educated guess based on what we know. Again, our actual knowledge is still heavily lacking. With the rise in acceptance and use, there will likely be an influx of studies to help us have better understandings of its effects on performance. Of course, it would have been cool if marijuana turned out to be the next miracle drug, the next creatine, if you will. However, it doesn't seem to be so at all. So if you don't already partake, you definitely shouldn't rush out to your closest head shop in hopes of setting a new personal best. If you do, know it's not doing you any favors, and it's likely even hurting you. However, it is a bit encouraging to see that it's not as bad as some have made it out to be. Assuming you follow what we recommend, you can help alleviate any bad effects that might present itself. With that said, if you have a choice between a protein shake and a joint, always choose the protein shake.